the treatment for NTRK fusions has been very revolutionary because, first of all, we have discovered one more type of fusions, and we know that we have therapy for now, despite the fact that a lot of people tell the lung cancer doctors, hey, you know, this is a very uncommon genetic aberration. Why you worry about that? Because we have so many lung cancer patients in America, around 225,000, a little bit more every year. Even if 0.3% carry this genetic aberration, there is a significant number of Americans that can benefit about that. Worldwide, we believe that maybe more than 8,000 or 10,000 patients may carry these genetic aberrations and they can benefit from new treatments. So that was one point. The other point is the fact that we're doing agnostic tumor therapy. Is the beginning of agnostic tumor therapy, and actually is amazing that we, in the original paper, there were 17 types of different tumors responding. And not even the tumors were different, but there were tumors in adults and there were tumors in children. That, as I said before, in oncology, we never did crossover before. We never give the same treatment to adults and kids. There are two different sciences, no? Pediatric oncology and adult oncology are very separated, and now not anymore. If we do agnostic tumor therapy, we'll be able to treat patients regardless if they are adults or children. The other important thing is we learned already about other tyrosine kinase inhibitors is the quality of life, tolerability, low toxicity profile. So we're providing cancer patients with therapy that may be very well for them. They not impair their quality of life, and they can stay longer. So in lung cancer, we always said we are trying to make this a chronic disease. So certainly, these type of treatments are helping us to make lung cancer a chronic disease, because as I said, at the beginning, we monitor these patients maybe once a month, but the survivors don't like to come. After 2-3 years, they said, you know, I go every month and nothing happens, so can I go every 2 or 3 months when I need to do my scan? So that's amazing, you know, so that's something that in our lifetimes, most of us are doing 20-25 years of lung cancer. It's amazing to see the difference. And that's why we give so much importance to the quality of life about this. So that's why for all of these aspects, I think the treatment of these NTRK oncogenes is very important, and also has been modelic because we have used this example to look for other types of tumor-agnostic therapy, as we are doing now, like a BRAF and other genes. That's why I think it's a very amazing story, very successful story. For example, testing, we're not going to find these patients if we don't do testing. And doing education like now, we're empowering the patients to request to be tested. Even if, for example, the original testing comes negative because it's a small tissue, we now can do liquid biopsies, and these NTRK aberrations can be found even in liquid biopsies. So that's why I think I want to give you also thanks for doing this. I think it's very good for our patients and for the doctors and for our education. For me, the most important element is to do the testing. I think our statistics show that we don't test all the patients yet, that maybe they need to be tested. And also our statistics show that not all the patients tested with positive oncogene results are getting targeted therapy because of many different problems, either access to the drug, problems with the payers, insurance, things like that. Or sometimes this test takes 2 or 3 weeks, and the patient gets impatient. He's already waiting months to meet the medical oncologist. No, by the time that they get a chest X-ray until they meet the medical oncologist, maybe 2 or 3 months. So when you're talking sometimes with the patient says, let's wait 3 weeks for your results, the patient says, no, I want my chemo tomorrow. And that's why there are many of these aspects that we need to work together to improve. Patients need to understand, for example, it's worth to be tested for this. Not only they can win several extra months of life, but a very good quality of life. So that is why, for me, the most important thing is to increase testing, increase access to these drugs.